Men die from breast cancer because they don't know they can get it. Tyler Main, Sabretooth from X-Men, who is 6'9", who's former professional wrestler, was just diagnosed with breast cancer. And his first instinct was to hide it. So if it can happen to him, it can happen to any man you know. I'm Dr. Alex Popovich, breast surgeon in Wellington, New Zealand. Stay with me because what I'm about to cover could save someone's life. Here is something that most people don't know. Every man in this world has breast tissue, and that tissue can turn cancerous. Underneath each nipple, there is a small amount of ductal tissue, and that tissue can undergo exactly the same cancerous changes as breast tissue in women. And this is not a rare freak occurrence. About 1 in 700 men will be diagnosed with breast cancer in their lifetime. In New Zealand, we see around 20 to 30 cases every year. I have 2 patients in my clinic that I follow who are men with breast cancer. Globally, men account for around 1% of all breast cancer diagnoses. Now, 1% sounds small, but that's still thousands of men each year being told that they have a disease they didn't know they could get. And because they didn't know, and because their doctors often don't think of it, they come to us breast surgeons late, much later than women do. And this is not a different breast cancer disease. It's the same breast cancer disease, just in a different body with far less awareness. So if men can get breast cancer, why is it found so late? That's what I want to cover next. And the answer will probably make you angry. Tyler Main's own doctor dismissed the lump he found. It was his wife who pushed for it to be investigated. And that push has saved his life. And this is not an unusual story. This is a pattern. Men don't expect to get breast cancer. So when they feel something, they wait. And when they do go to a doctor, breast cancer often isn't on the list of possibilities. The lump often gets attributed to a cyst or gynecomastia, which is a benign breast enlargement, which is often present on both sides. Or, even worse, it gets completely dismissed. There is no breast screening for men, no reminders to check, no awareness campaigns built with men in mind. The color pink, the awareness months, they matter, but they're culturally associated with women. And for some men, that makes stepping forward feel impossible. So by the time male breast cancer is diagnosed, it is far often at stage 2, stage 3, and unfortunately sometimes at stage 4. And later stage means often more difficult treatment and worse outcomes. And this is not inevitable. It's fixable. And the fix starts with knowing your risk. So who is actually at risk? Because it's not random. And some men are walking around right now with significantly elevated risk, and they have no idea. The most single important risk factor for male breast cancer is a BRCA2 gene mutation. So men with BRCA2 gene mutation have a lifetime breast cancer risk of around 6 to 8%. And that sounds low, but it is dramatically higher than the population risk for men, which is closer to 0.1%. BRCA1 mutation also increases risk in men, but not as much as BRCA2. And BRCA mutations are most commonly identified through a female relative who has had a breast or ovarian cancer diagnosis. I have a patient whose BRCA mutation in a family was diagnosed because he was diagnosed with breast cancer. So when there is a BRCA mutation in a family, we offer a cascade testing, but sometimes it's only offered to women in the family and the men get missed, or they don't think is important to have testing. So if there is a known BRCA2 mutation in your family, the men should be tested too. Because if a man has a BRCA2 mutation, he should be having annual clinical breast examination and annual imaging. The other risk factors include Klinefelter syndrome, which is a chromosomal condition where a man has an extra X chromosome. So instead of XY, they have XXY. It significantly elevates risk of breast cancers and other cancers. Age matters too. Most male breast cancers are diagnosed in men over 60. Tyler Main was 59. So the message is not that every man needs to panic. The message is that certain men are at elevated risk and they should be on someone's radar. But even if you are not high risk, you still need to know what to look for, because sometimes the signs of male breast cancer are not what most people expect. Chapter 4. What does it actually look like? Most men who are diagnosed with breast cancer thought the lump they found was nothing. Here's what to actually look for and what not to ignore. The most common sign of male breast cancer is a painless lump, usually directly beneath or near the nipple. And because men have so little breast tissue, tumors tend to sit centrally, close to the nipple and areolar complex. And often they involve the skin or nipple relatively early. This means that nipple changes in men are important, like nipple retraction, nipple discharge, skin changes around nipple like thickening, redness, dimpling. All these warrant investigation. And the lump is typically firm. It may feel fixed to tissue beneath it, meaning you can't actually move it when you try to. It feels stuck to the pectoralis muscle. It's usually on one side only. If you're a man and you find a lump under your nipple, or you notice any of these nipple changes, please go to your doctor fast. Don't wait. Don't assume men can't get breast cancer. And if your doctor dismisses you without imaging, push back. Ask for ultrasound. Ask for referral to a breast surgeon. Even famous person like Tyler Main had to have his wife push for further investigation. And that push changed everything. So you found something and you've gone to your doctor. What actually happens next? A lot of men delay going to the doctor because they don't know what's going to happen. So let me tell you exactly what happens. The diagnostic pathway for male breast cancer mirrors what we do in women. It starts with clinical assessment, the history and examination. We'll look for the lump's characteristics like the skin changes, the nipple, and whether there are any lymph nodes palpable in the armpit. From there is imaging. Mammogram can be done in men, and it is very useful because men have less dense breast tissue, so often mammogram is very clear. And we also do ultrasound to characterize the lump and assess the lymph nodes. So if imaging raises concern, the next step is a core biopsy. And this is where a needle is passed into this lump under local anesthetic to take a tissue sample. And this sample goes to pathology and tells us exactly what we are dealing with. The type of cells, how aggressive they look, and crucially, the receptor status. Is it estrogen receptor positive, progesterone receptor positive, HER2 positive, triple negative? And the receptor status is not just the label and determines the entire treatment plan. And that's what I want to cover next. Because treatment for male breast cancer is not exactly the same as treatment for women. And here's a particular difference that catches a lot of oncologists off guard. Most people assume male breast cancer is treated exactly the same as female breast cancer. It's mostly true, but there is one critical difference that changes a lot of things. The treatment follows the same broad principles as in women, with important differences in how we apply them. Surgery is usually first for localized disease. In women, we work hard to preserve the breast whenever possible. And in men, because there is so little breast tissue and tumors tend to sit near the nipple, mastectomy or removal of whole breast tissue is often required. Breast conserving surgery is sometimes possible, but it depends on the anatomy of male chest wall. And sentinel node biopsy is done at the same time, removing the first draining lymph node from the armpit to check whether the cancer has spread to that area. And radiation may follow depending on tumor size, nodal involvement, and surgical margin. Now, endocrine therapy, this is where male breast cancer diverges. Around 90% of male breast cancers are estrogen receptor positive, which is higher than roughly 75 to 80% we see in women. So endocrine therapy is relevant for nearly every man diagnosed. In postmenopausal women, we commonly use aromatase inhibitors like letrozole or anastrozole. And in men, these don't work as well. And the reason is physiological. When you block aromatase inhibitor in men, a feedback loop kicks in, and the pituitary, which is a little gland in the brain, signals the testes to produce more testosterone, which then gets converted back to estrogen. That can offset the effects of drug. So in men, tamoxifen is the preferred agent because it works differently. It blocks the estrogen receptor directly, bypassing that feedback problem. Side effects can be significant. Hot flushes, reduced libido, mood changes. Same as menopausal symptoms in women. But for most men with ER-positive disease, tamoxifen is the standard of care. Chemotherapy is used in high-risk cases like larger tumors, nodes positive, more aggressive biology like HER2 receptor positivity. Tyler Main has announced that he's starting chemotherapy at diagnosis, which tells us that his team considered his risk profile for his breast cancer significant. HER2 targeted therapy is used where tumors are HER2 positive. So what does all this mean for the outcome? The survival statistics for male breast cancer look worse than for women. But it's not because the disease is more aggressive. The reason is something we can actually fix. When male breast cancer is caught early, the outcomes are good. Stage for stage, the prognosis in men is roughly comparable to women. The problem is that men don't present stage for stage equally. They come in later. That's why the overall survival statistics look worse. Not because the breast cancer biology is more dangerous, but because the diagnosis of breast cancer is delayed. And this is a systems failure, a knowledge failure, a stigma failure. If more men knew they could get breast cancer, they would find lumps earlier. If doctors held it in mind, they would investigate sooner. If families understood that BRCA2 affects men too, those men would be monitored. Tyler Main is 59. He found a lump. His doctors dismissed it. His wife pushed. He was diagnosed. He's now speaking publicly about it, and that decision not to stay silent has potential to change outcomes for many men watching him right now who recognize something in their own story. So what does Tyler Main diagnosis tell us? It tells us that breast cancer does not discriminate by sex. It tells us stigma and silence lead to late diagnosis. It tells us a push from a partner, a doctor, or yourself can be a difference. So if you're a man, if you feel a lump under your nipple, get it checked. Now, don't wait. If you have family history of breast cancer, especially known BRCA2 mutation, ask about testing for the men in your family. And if your doctor dismisses a breast cancer concern without imaging, push back. Ask for a referral. And if this video reached someone who needed it, please share it. That's the only reason I made it. I will link a couple of videos on breast cancer diagnosis and staging that might give you more information about breast cancer. Thank you very much for watching this. Bye for now.